thank you for being the army that defeated Donald Trump in the Republican Congress. And thank you on behalf of myself and all of us who worked for President Obama and his administration. Thank you for being the army that put the Affordable Care Act in place to start out with. This issue did not hit close to home for me and my wife. Earlier this year, our 10-year-old son went to his annual checkup. Great doctor, a great doctor who he's able to have because we are privileged and we have health insurance. And during the course of his checkup, the doctor found tumors in my son's neck. And she said, look, we need to get this dealt with really quickly. And so he then began going through a lot of really expensive medical procedures. And the news was getting worse and worse. And one of the things that a doctor at Johns Hopkins said to us, he said, you know what, we really should get a specific genetic test, but it costs $6,000. But we need this genetic test because if you test positive for this genetic mutation, then there's a 40% chance that the tumors in his thyroid will become malignant and could end his life. And because we had health insurance, we were able to get this $6,000 genetic test. The news was bad. We tested positive. But again, because we had health insurance, the doctors working really aggressively with us got my little boy, got Sawyer, into an operating room. They took out his thyroid, they got the tumors out of his neck. He went through an amazing course of care. And a couple months later now, he's okay. But what makes me angry, and part of why I'm running for governor right now, is that the only reason my 10-year-old boy is doing okay right now is because we have health insurance. Because my wife is such a powerful advocate for our kids. What's remarkable to me is that if he had different parents, if he were one of the millions of uninsured, he would never have had that appointment with that doctor who would have found the tumors in his neck. Being able to get the tests, the genetic test, and the course of care that he got, he would not have had one of the world's best doctors at Johns Hopkins taking care of him and doctors opening up his neck and taking out that tumor. I don't want to live in an America where if you're a 10-year-old little boy and your parents have health insurance, you live. If you're a 10-year-old little boy and your parents don't have insurance, you might die.
We're going to talk about what recently happened with Care First. So, Chrissy.
Addiction and Care First. Before I talk about Care First, can you raise your hand if you have Care First? Okay, they own 75% of our market here in the state of Maryland. They bill $8.8 billion in revenue. They have 3.5 million members, of which 640,000 of them are federal employees, 30,000 of them are our teachers and our county workers. And if you are a county worker or a teacher, you have no other choice but to have Care First as your insurance provider. That sounds like a monopoly to me, right? Do we have a seat at the table to talk about what we want? No seat at the table. Nobody's asking us. They just charge our premiums, tell us what they won't pay for, won't give us access to, like Anne Arundel Medical Center, and tell us that we just have to deal with it because they are the insurance provider. We can do better than that. We can do better than that. And on great legacy center. We have invited executives from CareFirst. We have invited executives from Anne Arundel Medical Center so we can find out what's going on with our healthcare. Why do we have to ask executives what's going on with us, with our health? So we've invited them, we've invited our legislators. So far, our Maryland officials have been silent. Steve Schuh wrote us an email saying, let them figure it out. Really? I thought we were paying you our tax dollars to be our voice at the table. How come we don't have a voice at the table? Where's our governor? We pay him our tax dollars. We pay him his income, his pension, and his health care. And he is not representing us. We have no voice. Come August 14th, bring your voice. Let's get these people to talk and to figure out where is our health care. Our care, not our insurance. I'm talking about care. Let's change the conversation. Let's cover Lyme's disease, right? Lyme's disease is connected to autism, by the way. It's connected to Alzheimer's, MLS, Parkinson's, right? There's so many diseases that CareFirst won't even cover for us. Let me give you a history on hemophilia. My son was born in Virginia in 1995. It's a Republican state. There was no ACA. Anthem Blue Cross said he is uninsurable. He was born with a pre-existing condition. He was at Virginia Hospital Center. They put an IV in his head and told us that he was uninsurable and the bills were not going to be covered. Not only was it devastating for young parents to get the diagnosis of severe hemophilia A, we were now uninsured with multiple bills. We spent 5 years fighting in Virginia, couldn't get any health insurance. We moved to Maryland. I'm from Maryland. I'm a Terp. I've been here a long time. We have been fighting CareFirst, Blue Cross Blue Shield for decades. We were in front of Governor Ehrlich. We have been fighting insurance commissioners for coverage. And do you know why hemophiliacs need coverage? They have to self-infuse every other day. Their medication is $2,000 a dose. My son goes through $250,000 worth of medication a year to be normal, to be an honor student at College Park, University of Maryland. Yay! Right? At 26, under the Affordable Care Act, he could actually lose his insurance. The Senate was voting for him to lose his insurance. How do people with chronic illnesses that run bills like that supposed to pay for their medication? The Affordable Care Act didn't come out of nowhere. We have spent years lobbying our federal legislators to cover us. No lifetime cap, no pre-existing condition, and to cover our children until they are 26 so that they can be earning an income. But more importantly, under the Affordable Care Act are the essential benefits. It's the essential benefits that actually make this world real for us. Covers hospitalization, maternity, addiction, pharmaceuticals. Our Senate wanted to gut that. They want to take those essential benefits out and turn it back to the states. When we do that, it takes us back to circa 1995, when the states and the insurance companies can decide at will what will be covered and what won't be covered. And guess what? Hemophiliacs don't die like addicts. Hemophiliacs stay alive. And there are 300 of them here in the state of Maryland. And without health insurance, we become a line item on the state budget for $75 million a year. And that's the key.
My head, and I was like, what?
So we don't die, we get really expensive. Addicts, on the other hand, die. And the legislators know that. And that's why we don't get any money. The addicts, and what Governor Hogan's doing, he is giving pennies on the dollar of what's needed to help with this epidemic that we have today. The cure for addiction is long-term recovery. CareFirst says it's 2 weeks. If you are a long-term addict, 2 weeks doesn't do anything. It's nothing. That's a half a step in a long road to recovery. My children's father died of alcoholism in 2010. Anne Arundel Hospital System kept throwing him out on the street to die. They would ask him in an alcoholic state, do you have health insurance? No, he's an addict. What addict in full-blown addiction has health insurance? They would ask him in a drunken stupor, do you want recovery? And he would say, no, he was drunk. What drunk in active addiction is going to raise their hand and say they want recovery? For those two reasons, Anne Arundel kept throwing him out on the street. And they would tell themselves, he didn't want it. He didn't want recovery. He was insane. People in full-blown addiction are insane. That's how they stay in addiction. It is important to understand recovery, which is the breakdown of their spirituality, their mental, and their physical. And to recover on the physical, you need long-term recovery. You need to stay in the hospital for months so that your body can heal, so that your brain can catch up, and eventually you'll recover spirituality. That's how addicts recover. Millions of people have recovered from addiction, but some of them need more help than others. And our state and our hospitals are throwing people on the street to their death the way that they did to my children's father. That's what needs to be funded. What's going on with Crownsville down the road? Why is that a ghost town? Why can't we put beds, recovery beds in there? We don't need just safe stations. We need long-term recovery beds for those people that suffer from the disease of addiction. It's a disease. Finally, what we're going to do here today and what we're hoping for is that people will listen to us, that we need health care for the people. We need to change the conversation from covering and protecting insurance companies to protecting and curing people. So keep coming back, keep coming back. From August 14th, thank you.
So healthcare and healthcare coverage is a nonpartisan issue, we can all agree, right? So on August 4th and 5th, Progressive Maryland is going to be doing healthcare canvassing across the state. We're looking for people that are interested in getting out there with us and talking to our friends, our neighbors, the communities, and getting stories, finding out what's really happening. And it's not what letter you have after your name, D-R-I-G, whatever. It's just about talking to people who live here. We have campuses going in Annapolis County, Montgomery County, Frederick County, and Howard County. But if you would like to start your own campus in another county, that would be fantastic. Or if you want to join ours, let us know. You can either text the number that we talked about before, or talk to me or Beth or Claire Miller, who's right there. Raise your hand, Claire. And I think we've got other Progressive Maryland representatives here as well. Raise your hand if you're with Progressive Maryland. Hey, there you go. We got it. Okay. So just let us know, and we'll hook you up. Okay. So diabetes is another healthcare script. My father has type 2 diabetes, and I watch him suffer every day. One of my best friends, one of her kids, has type 1 diabetes. And our next speaker is a nurse who specializes in diabetes. It's Mike Taylor.
It's a privilege and an honor to be in a profession before you say much. But each one of you is also a lifesaver. When you voted in, those both Republicans and Democrats that pushed through the Affordable Care Act literally saved lives. And I want to tell you, about the people whose lives you saved. Prior to the Affordable Care Act, I would have patients who are entrepreneurs. These are people who are upper middle class professionals. They're go-getters. And they would come in my hospital and they would have diabetes brand new to them. And it was not their fault, but they would have this condition. And then they would go seek out insurance. But because they have this pre-existing condition, the marketplace solution that's been pushed by the radical friends of the Republican Party, it does not work. This gentleman could not buy health insurance. No one would sell it to him. He's on a cash basis. And believe me, if you see your hospital bill, you do not want to be on a cash basis when you come with health care. So besides people who could not even participate in the healthcare market, then I would have children who would have type 1 diabetes. And they would go to college. And most No, you don't have your own. Because how can you afford college and health insurance? These are very tough, stark choices that people have had to make.
How much
So
is my
many
cost?
times a child would decide, well, maybe I'll get an associate or bachelor's degree, but I will not be able to go to graduate school because I first have to get a job to get health insurance. Is that unfair? People should be able to go on and be the full people that they can be without having to worry about health insurance. Has changed that. Now, you have up to 26 years of age to stay on your parents' insurance. And there is now a discussion anymore when they work. There are problems. Anyone here on insulin? You don't have to raise your hand, but I assume there are some people here on insulin. It's just too darn expensive. Having worked in diabetes on a national basis, I think Casey knows that. Casey just told me she has type 2 diabetes. She probably knows more about it than I do. I've been in the mattress with a big insulin. I'm a business specialist in healthcare. There is no good reason, business or otherwise, why insulin should be this expensive. It is approaching price gouging. There are things we can do as a community, Republicans, Democrats, Independents. There are still holes to fix. The idea that the marketplace is the way to go with high deductible plans so you have low premiums, that just doesn't work. My own daughter, she was able to get insurance. She's a young girl. She's able to get insurance on the Maryland Exchange. She came to me and said, Dad, what is your opinion? I want to get this low premium plan where the deductible is $6,000. I said, if you get this plan and you have a child, guess what? You're going to have a child and a $6,000 bill. Okay? So she went for a low deductible plan. Low deductible plans do not work. I still encounter people in my hospital who are struggling with the day-to-day choices. There are still people. I had one woman recently who was faced with either buying insulin or paying the rent. This was the stark choice she had before her. She chose to pay the rent. Why? Because if she bought insulin, maybe she'd be on dialysis in 15 years, but if she didn't pay the rent, she'd be homeless tomorrow. Is this a choice we want for people here? To choose between being homeless and having health care, this is not an appropriate choice. So patients now, they're not waiting for Congress. They're having to make these choices in very difficult ways. Many people now are going on the illegal market or the alternate healthcare market. They're buying insulin, they're buying blood glucose test strips on eBay. Families are working together. They're sharing insulin, they're sharing syringes, they're sharing blood glucose test strips in order to make it. People should not have to make these such stark choices. We already have been lifesavers as voters. There are additional steps to take. There are still people who are struggling and going into bankruptcy because of the cost of their health care. Support those that support health care will help me do my job better, and I thank you.
Thank you, Mike. Okay. Some of you are probably wondering about cake, right? You know we have cake. So our plan right now, we have four speakers, and after the last speaker, we are going to march around the governor's mansion, and anybody who's with us can come back for cake. Okay. Tiny pieces if everybody wants some. She mentioned diabetes, now I feel terrible. Next time we'll have sugar-free cake as well. Okay. Okay, our next speaker is Jackie Black. She's a mother, grandmother, and a healthcare advocate with a story to tell. Jackie.
Thank you. Thank you so much for letting me tell part of my story. Currently, a war is raging in our country over how to approach the provision of health insurance and medical care and medical services to the American people. Illness has nothing to do with political correctness. Illness has a face and it has a name. And for my story, the name is Jacqueline Black. In 2009, I began to experience devastating changes in my physical and mental health. These changes eventually led to me becoming disabled. In 2009, I had health insurance through my employer. I was working full-time as an LPN. That insurance was allowed to continue until my short-term disability ended. But at this time, when my family medical leave ended, I lost my job. I lost my health insurance. For the first time in my adult life, I wasn't able to pay my bills on time. As a result of all of these things, I ended up losing my car, my home, my health. So everything that I had worked so hard for in this life was disappearing just because I got sick. And I was becoming overcome with medical bills. I'm thankful that my daughter, Teresa Black, who spoke, who's running for Congress in the 4th District, she had recently joined the Navy. And as a military person, she began sending me funds to help take care of me during this time. This period lasted about 3 years until I was finally able to get my disability and be able to provide for myself. But I thank God that through that period, I didn't end up on the street. I did end up going from a 3-bedroom home to a bedroom, and then eventually to a 1-bedroom apartment. But I'm thankful for the health services that eventually I was able to obtain. Through part of this time with no health insurance, and by this time I was on all kinds of expensive medications and having to see different specialists, it was almost impossible. So I'm also thankful for the companies that that have patient assistance programs to provide medications to people who don't have their insurance. And the free clinics who help people who no one else will take the time to see. It's important that we stand together for these things because, like I said, illness doesn't discriminate. It doesn't care what your race is. It doesn't care if you're Democratic. It doesn't care if you're Republican. It doesn't matter if you're rich. It doesn't matter if you're poor. It hits everybody at some times. It hits our children. And we need to be able to have the resources to provide the care that they need. It's so important. So many lives are lost for no reason. There are people who could have been saved, people whose problems could have been fixed. So we have to keep standing for our country, standing for our rights, advocating for one another, because some people have no one to advocate for them to even know what's available to help them. And it's so important. And so I'm thankful that you allowed me to tell my story, a part of my story. And I'm hoping that things will work out for our country, that we are able to get the services we need to provide for ourselves and the people we love to have our health taken care of. Thank you.
Thank you, Jackie. I just want to say I really appreciate all the speakers coming out, especially people who are telling their personal stories, because it's not easy. And we want to keep hearing your stories, so please hook up with us after this.
I understand I'm between you and the skies opening up, so I'll be brief. First of all, I want to thank you. Give yourselves a round of applause for being out here. After yesterday, we weren't sure that people would show up because of what they did in Congress. But I don't know if anybody thinks that, where we wanted to get to was the Affordable Care Act. The Affordable Care Act was just the beginning. The object was to get to universal care. To really make health care a human right. So the fact that we have just landed in place is not enough. But in order to make people realize why this is so important, that this is not just an argument between Democrats and Republicans, that this is not just Trump, this is not just about Larry Hogan, this is about real people. Think about the stories you've heard today. I know when I hear the stories here, I think about my own and I think about my wife. I think about the fact that, when I became county executive, I never thought I would talk about health care. It wasn't my issue. What I wanted to talk about was education and public safety. But when I became county executive, I figured and found out that you can't deal with public safety and education unless you talk about access to quality health care for everybody. And if I didn't understand the lesson, I was soon going to learn it, my family was going to learn it. Those who know me and know our story, I have the most beautiful, smartest wife in the world. She's the most amazing person I have ever met in my life. I never bought a pair of pants, a suit, a car, a house. Once I met her, that is the God's truth. And I never thought at 48 she would not work again. And I never thought at 52 she would not speak again. Because we never thought she would get early onset Alzheimer's. I didn't think the day that I raised my hand on the Bible to be county executive that my children and I knew it would probably be the last time their mother would ever stand on her own. I don't say this for people to say, oh my God, we feel bad for you. I say this because we are so blessed. We are the most blessed family in the world. Because her husband has health care, her children were in college, they have a great education. And when I go to the pharmacy and they don't have my medicine ready for her, that she's on for life and I can't understand why the heck they don't, you know what I do? I say, I'm not going to wait for you to call the doctor for the 70th time, figure out why they're gouging the cost of the medicine. I simply buy it. But it makes me as a leader understand that what this should do is not just say, hey, I'm glad I have health insurance. What it should do is motivate you to change the situation for other people. That's what she would do. She would not want us to simply focus on the fact that we have this. Why hasn't everybody in America, in the richest country in the world, in the richest state in the world, why are we still talking about it? Why are there people who have to make a decision between prescription drugs and paying their mortgage? That makes no sense. That is what this fight is about. This is the beginning, and Maryland should lead the way. When I was here in this place, we talked about reforming healthcare in the 90s. Maryland led the way on that. We should be not down there waiting to see what happens on Capitol Hill, waiting for what happens. We should be putting a plan together ourselves. We should be leading down there, not sitting back. That is what we're doing. So yesterday was simply a mark in the road for us to go out there in this great state and lead. That's what this march is about that you're about to take on. Us putting forward a plan to lead not only Maryland, but to lead this nation. Making healthcare a right, a human right. God bless you.
What do you mean?
Hey, hi!
Somebody, representative. It's such a clever way to make it.
Yeah. Good. You and I need to talk. Okay. Yeah. What's the name of the business?
You're actually Maryland University. Been around since 2000.
We need a job because I'm working in the
So where's the chanting going? Right. My husband has helped a lot. You know, he was past president for
my colleague.
Is it healthcare is a human right? All right, healthcare is a human right. Of the first law, let alone passed.
The 25%.
Yeah, he worked on a lot of that.
Well, we're looking to bring it to 50%.
Yeah.
This year, next year. Sure, I'd love to meet him. I'm going to take...
Healthcare for all. Healthcare for all. Healthcare for all. Healthcare for all.
What's the name of your name?
Healthcare for all.
Healthcare for all. Healthcare for all. Just right, so